Hello everyone, you are watching Physio Classroom channel and this is our 8th video of PNF series. In today's video, we are going to discuss and practically demonstrate the 5th special technique of PNF, which is known as contract relax. Contract relax technique should be utilized by the therapist with the main aim of improving the passive range of motion in any joint. Now, this is the commonest of all technique which is utilized by the therapist to treat post-fracture stiffness, conditions which are having restricted joint ranges like frozen shoulder, and also to improve flexibility in normal individuals through PNF stretching. So to discuss the technique further and demonstrate it practically, I have with me Jyotsna Pundir, who is a physiotherapy student here at SRHU. So let's first understand how contract relax technique works with a simple example in which the patient is having restriction in the elbow flexion range of motion. Now in contract relax technique, the emphasis is to gain relaxation of the tight group of muscles. So that means if elbow flexion range of motion is restricted, then this is due to tightness in the antagonist group of muscles, which are the extensors of the elbow joint. Now in contract relax technique, this relaxation of the antagonist or the tight group of muscles can be achieved by two simple methods. One is the contract relax direct treatment method and the other one is known as contract relax indirect treatment method. So let's first understand the steps of treatment in contract relax direct form of treatment. Now contract relax direct method involves resisting the isotonic contractions of tight group of muscles followed by their relaxation and moving the joint into the newly improved range of motion. So let's understand this first with an example. Now Jyotsna is having tightness in the extensor group of muscles, because of which she is having restriction in the elbow flexion range of motion. So step 1 is to put the joint in the end range of available motion. Now this can be done in two ways. One is by putting the joint passively into the end range of motion, or the second way is to ask the patient himself or herself bring the joint into the end range of restriction against little resistance of the therapist. So Jyotsna, bend your elbow as far as you can. Keep bending, keep bending, keep bending, keep bending, keep bending. Very nice. Keep bending, keep bending, keep bending. Can you go any further? Okay, so Jyotsna has put her elbow joint into the end range of restriction against my little resistance. Now the step 2 in contract relax is to ask for a strong isotonic contraction of the antagonist group of muscles. Now Jyotsna, push down against my hand with your best effort. Push down, push down, push down. Keep pushing, keep pushing, keep pushing. Good. Now this resistance to the isotonic contraction of the antagonist should be maintained for at least 5 to 8 seconds. And now relax. And now, once the patient relaxes, the joint should be repositioned into the newly improved range. Again, this repositioning of the joint can be done either passively by the therapist or actively by the patient against the little resistance of the therapist. Now, Jyotsna, let's see how far you can bend your elbow. Keep bending, keep bending, keep bending. Very nice. Keep bending, keep bending, keep bending. So now Jyotsna has kept her elbow in the newly improved range of flexion. So now we have completed one cycle of contract relax, in which the first step was positioning the joint into the end range. Second step was asking for a resisted isotonic contraction of the tight group of muscles. Third step was relaxation, and the fourth step was again repositioning the joint into the newer range. Now this cycle should be repeated many times or until the therapist finds out that no further improvement in the joint range is taking place. Now, how to conclude the contract relax technique? Now let's say Jyotsna was having a pre-treatment elbow flexion range of around 50 degrees. And after the treatment by contract relax method, her elbow flexion range has improved to 70 or 80 degrees. So that means she has improved 20 to 30 degrees in her elbow flexion range. Now, contract relax technique should be finished by exercising both the agonist and the antagonist group of muscles in the newly improved range. This is so because the joint was having restriction beyond 50 or 60 degrees of flexion, and now the joint suddenly has an increased range of 20 degrees. Now the muscles that are responsible for movement of the joint in the newly improved range should be exercised enough so that patient develops good joint stability along with the improved joint mobility. So Jyotsna, pull up against my hand, pull up, pull up, pull up, pull up, very nice. Now push me down, push me down, push me down, push me down. Now pull up again, pull up, pull up, pull up. Now push me down, very nice. So I have exercised the joint in the newly improved range, and now I can conclude my treatment of contract relax direct method. Now this method of contract relax direct treatment is based on the principle of autogenic inhibition. That states that a muscle goes into a state of sudden relaxation after it has underwent significant contraction for certain duration of time. So contract relax is contracting the tight muscle followed by its relaxation due to autogenic inhibition. Now, in certain situations, we might find that the contraction of the antagonist group of muscle is either too weak or too painful to carry out with the treatment. In such situations, the therapist can resist the isotonic contraction of the agonist group of muscles instead of the antagonist, and that becomes the contract relax indirect method of treatment. So if patient is having restricted elbow flexion range and contracting the antagonist against resistance is painful, or patient is having weakness in the antagonist group of muscles, because of which we cannot carry out the contract relax direct treatment. Now in this situation, the therapist can resist the isotonic contraction of the agonist group of muscle. So now Jyotsna, what I want you to do is to pull up against my hand. Pull your hand up. Good. Pull your hand up. Keep pulling, keep pulling, keep pulling, keep pulling, keep pulling. Now this contraction of the agonist group of muscle should be resisted for around 5 seconds, followed by its relaxation, and now repositioning the joint into the newly improved range, either passively or actively by the patient against little resistance of the therapist. The second method of contract relax, which is the indirect method, focuses on gaining relaxation on the tight group of muscles through the principle of reciprocal inhibition, which states that when the agonist goes under contraction, it is associated simultaneously with the relaxation of its antagonist. Now, this was a very simple example to make the students understand how contract relax technique works and what is direct method and what is indirect method. Now, contract relax, although it is being practiced in the same way in clinical settings by majority of the professionals, but now let's understand few more tips and tricks to practice contract relax in a more better manner. So now let's see how contract relax technique can be practiced in a more effective way. Now I am going to choose a functional task that requires the elbow flexion movement and is a part of ADL activity. Now I am going to give a cup to Jyotsna, and let's say now she is a normal individual. Let's first analyze the motion of drinking a cup of tea. So Jyotsna, just mimic the action of drinking the tea. So if we observe the joint motion for this action, we can easily find out that it requires shoulder abduction, external rotation, elbow flexion, forearm pronation, wrist radial deviation and extension. So now we have a fair idea of muscle synergies in the agonist as well as in the antagonist direction. So now let's see how contract relax technique would look like now. Jyotsna, hold this cup and try to bring it as near to your mouth as you can. Good. Keep going, keep going, keep going. I will keep resisting the pattern. Keep going, keep going. Now, Jyotsna, can you go any further?
No.
Okay. So now the next step would be to resist the antagonist muscles. Now, previously, I was only resisting the elbow extensors. But now the advantage here is I can resist the whole synergy pattern by asking the patient to put the cup back down. Now, do note how I am going to resist using my proximal and my distal grip. So Jyotsna, now put the cup back down. Good. Keep going, keep going. Put the cup down, put the cup down. Now just observe how all the antagonist group of muscles are getting activated and resisted by me. Now resistance to the whole synergy pattern is going to activate all the antagonists and thereby relax the whole group of muscles. Now relax. Relax, relax, and now bring the cup back again near to your mouth. Bring it near to your mouth, bring it near to your mouth, bring it near to your mouth. Good. Now again, bring the cup back down, bring the cup back down, bring the cup back down. Good, good, and relax, and relax. Now again, bring it near to your mouth, bring it near to your mouth. Keep going, you're doing good. Very nice, very nice. Good. Now again, bring it down. Bring the cup down, bring the cup down. Good, good, and relax. And relax. So what I wanted to demonstrate was a more effective way of practicing the contract relax technique. Now remember, the range that we gain after the treatment of the contract relax method should be followed up by resisting the agonist and the antagonist group of muscles in the new range, somewhat like this. Now Jyotsna, bring the cup up near to your mouth. Keep going, keep going. Good, good. Now bring the cup down, bring the cup down. Good. Now bring the cup up, bring the cup up. Very nice. And now bring the cup down. Thank you. So knowing PNF treatment strategies totally changes the way of how we treat our patients. Now again, remember, I have still not demonstrated any PNF pattern, and yet we are able to treat so many conditions. Now when we use the contract relax treatment method or the hold relax treatment that we are going to discuss in our next video to stretch a particular muscle, then this particular form of treatment is termed as PNF stretching. PNF stretching emphasizes again on improving the flexibility by stretching the tight muscles. So now let's just quickly demonstrate the traditional way and the PNF way of stretching a particular muscle by taking an example of right upper trapezius. So now let's say patient is having restriction of left lateral flexion due to tight upper trapezius on the right side. So normally we stretch this muscle by stabilizing the right shoulder and bringing the head and neck into the range of restriction and holding that position for 5, 10 or 15 seconds so that the muscle starts gradually lengthening up. Now in PNF stretching, what we need to do is we need to position the head and neck again into the end range of restriction and now ask the patient to push against my hand so as to come in the midline. So Jyotsna, you need to push against my hand and try to come in the neutral position. Okay, so push, 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 and relax, relax, take it to the newer range, push, 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 keep pushing, and relax, 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 taking it to the newer range. And this can be repeated again and again so that we can gain more and more lateral flexion to the left side and gaining more flexibility in the right upper trapezius. So this was all about the fifth special technique of proprioceptive neuromuscular facilitation, which is known as contract relax. I hope I was able to simplify it for you all. Do keep motivating us with your valuable comments and feedback. We will see you in our next video, and till then, keep learning, keep sharing, and stay connected.